Welcome back to the Devine Inspired Care channel, where we continue in the series of women's health. Sexually transmitted diseases pose a significant global health challenge, encompassing a wide range of infections caused by various pathogens. Unquestionably, this is a pressing subject that we, as a global community, need to address urgently. Stick around until the end, and you will know how to prevent yourself against STDs and who to manage it if you have it. STDs are not confined to one specific demographic or region. They affect individuals across all social groups, regardless of their age, gender, or geographical location. Often, these diseases are silent invaders, manifesting no immediate symptoms, which makes them even more dangerous. They are caused by bacteria, viruses, or parasites that pass from person to person during sexual activities. Their effects on the human body vary, ranging from mild discomfort to severe health problems that could potentially lead to death if left untreated. However, it's important to note that sexual intercourse isn't the only medium of transmission. In some cases, they can also spread through non-sexual contact, such as blood transfusions or shared needles among drug users. Pregnant women can also pass some STDs to their babies during childbirth or breastfeeding. Furthermore, the growing prevalence of these diseases worldwide is a cause for concern. According to the World Health Organization, more than 1 million people acquire a sexually transmitted infection every day across the world. In terms of numbers, this is an alarming statistic that underscores the gravity of the situation. Moreover, the stigma associated with STDs often prevents individuals from seeking timely medical help, thereby exacerbating the problem. It's crucial to promote awareness, encourage regular screenings, and ensure access to effective treatments to combat this health crisis. The most common STDs include chlamydia, genital herpes, hepatitis, HPV, and HIV/AIDS. Each of these infections has unique characteristics, symptoms, and effects on the body, and are caused by different types of bacteria, viruses, or parasites. Chlamydia, caused by the bacterium Chlamydia trachomatis, often shows no symptoms, making it difficult to diagnose without testing. Untreated, it can lead to severe reproductive and other health issues. Genital herpes, a viral infection caused by the herpes simplex virus, can cause painful sores on the genital area. Although it can be managed with antiviral medication, there's currently no cure. Hepatitis, particularly hepatitis B and C, can be sexually transmitted. Both can lead to chronic diseases and are major causes of liver cancer worldwide. They are preventable with vaccinations and treated with antiviral drugs. HPV, known as human papillomavirus, is a very common group of virus. Usually has no symptoms, so you may not know if you have it. In some people, it can cause genital warts or cancer. You can get HPV from vaginal, anal, or oral sex and sharing sex toys. You can reduce your risk of HPV by using condoms during sex. There's also a vaccine for some types of the virus. HIV/AIDS is caused by the human immunodeficiency virus. It interferes with the body's ability to fight off diseases, leading to acquired immunodeficiency syndrome or AIDS. There's no cure, but with proper medical care, HIV can be controlled. Risk factors for these STDs are not limited to the act of sexual intercourse. Unprotected sex, having multiple sexual partners, a history of STDs, and sharing of needles in drug use can significantly increase the risk of transmission. The best way to prevent STDs is through condom use, regular testing, and vaccination where available. Some being curable and others not. It's vital to remember that early detection and treatment can significantly reduce the long-term complications associated with STDs. Symptoms can be varied and often unnoticed without testing, an aspect that cannot be overstated. This fact underscores the urgency and paramount importance of regular screenings. Regular screenings allow healthcare providers the opportunity to diagnose sexual transmitted diseases or STDs as early as possible. This is critical as it provides patients a chance to receive treatment before the progression of the disease. In today's world, where a plethora of diseases lurk undetected, it is crucial to not overlook the importance of regular health checkups and screenings. These can pave the way for early detection and timely intervention. STDs often exhibit symptoms that can be overlooked by an untrained eye, making it all the more crucial to undergo regular screenings. The second half of this equation is treatment. As one can expect, Treatment modalities for STDs depend heavily on the type of STD diagnosed. Different types of STDs require different treatment strategies. To that end, antibiotics prove to be exceptionally effective for bacterial and parasitic STDs. These medications work by eradicating bacteria or parasites from the body, thus eliminating the infection. However, for viral infections, things get a bit more complex. Antibiotics are ineffective against viral STDs. Instead, management strategies are brought to the fore. These strategies often involve a combination of medications designed to control, rather than to cure the infection. It could include lifestyle changes, supportive care, and other approaches that help manage the symptoms and slow the progression of the disease. Prevention is key and includes various strategies from abstinence and vaccinations to monogamous relationships and avoidance of risky behaviours. Let's break it down and explore each of these strategies in greater detail. Abstinence, the practice of refraining from certain actions, is a powerful tool in preventing the spread of many diseases. It is the most reliable method of avoiding sexually transmitted diseases, including HIV, and preventing unintended pregnancies. Next, we have vaccinations, which are essential for maintaining public health and preventing diseases that were once widespread and deadly. Vaccines work by preparing your immune system to fight off infections before they occur. Let's move on to monogamous relationships. When it comes to sexual health, being in a committed monogamous relationship can significantly reduce the risk of disease transmission. When two people are exclusively intimate with each other, they significantly limit their exposure to potential infections. Lastly, the avoidance of risky behaviours can also play an enormous role in prevention. Risky behaviours, such as drug and alcohol abuse or unprotected sex, can lead to numerous health complications, including vulnerability to disease and illness. In conclusion, prevention is not just about one action, but a composite of many strategies. It involves a combination of behavioural changes and medical interventions. It's about making healthier choices for ourselves and for our community. By embracing a lifestyle of safety and health-conscious decisions, we can significantly reduce the risk of disease and promote a healthier society. Knowledge empowers us, making us aware of the dangers we can face, the symptoms that can help us identify those dangers, and the strategies we can use to prevent them from wreaking havoc in our lives. A comprehensive understanding of various health risks is essential in the modern world. There are countless diseases around us, both visible and invisible, known and unknown. They lie in wait, ready to strike when we are most vulnerable, when our defences are down. We must be vigilant, always prepared. Symptoms act as our body's alarm system, signalling when something is wrong. Recognizing these signs early on can mean the difference between a simple treatment or a prolonged battle against a disease. It is vital not to ignore these signs, continually tuning into the messages our body sends us. Prevention strategies are our foremost line of defense against diseases. They allow us to take control of our health, to keep diseases at bay before they can even take root. These strategies range from maintaining a balanced diet, regular exercise, to vaccination, screening tests, and more. They remind us of the old adage that prevention is better than the cure. By arming ourselves with this knowledge, we become the master of our health, capable of safeguarding ourselves and those we care about. We transform from being potential victims to vigilant guardians. All it takes is staying informed and taking the necessary precautions. Thank you for reaching this far in the video and for engaging with us. Let us know what you think in the comments section. Please help us to spread awareness. Remember to like, share and subscribe to our channel so you can get all the latest medical information that affects us every day. Stay informed, stay healthy until next time. Goodbye.